Issues to be considered in the radiotherapy process. Module content. Module outcomes. Aim of the module. What is radiation therapy? What is the purpose of radiation therapy? Do you know who is applying radiation therapy? The side effects of radiotherapy. What is radioactivity after radiotherapy? Radiotherapy and pregnancy or fertility. Does radiation therapy cause cancer? Is radiation therapy safe and effective? References. Module outcomes. At the end of this module, the patient caregiver will learn about to explain the mechanism of radiation therapy to patients at a simple level, to introduce the treatment methods and to introduce the treatment team. To understand the purpose for which radiation therapy is used and accordingly the effectiveness of the treatment. To provide general information about radiation side effects and to enable patients to fight these effects at a basic level. To clearly state the answers to frequently asked questions about radiation therapy. Aim. The aim of the module is to provide basic information about radiation therapy to patients, to form basic information about side effects. What is radiation therapy? Radiation oncology is a treatment option in which radiation energy is used in ionized form. The basic and common way of obtaining ionizing radiation is by interacting atoms with electrons. As a result of these interactions, X-rays and photons are produced. What is radiation therapy? The X-rays and photons produced are used in the irradiation process. The ionizing radiation damages the cancer cell and triggers the death of the cancer cell. Ionizing radiation is an essential treatment option in various types of cancer. Radiation therapy is basically used for three purposes. The curative treatment. The adjuvant and neoadjuvant treatment approach applied for complementary purposes. The palliative treatments to increase the quality of life of patient when it is not possible to eliminate the disease. What is the purpose of radiation therapy? In curative radiotherapy, the main structure of the treatment is carried out by radiotherapy. Other treatments such as chemotherapy or surgery may also be used if necessary. The complementary radiotherapy aims to enhance the success of other treatments such as surgery and chemotherapy. Neoadjuvant radiotherapy combines presurgical radiotherapy with chemotherapy to improve local control, improve overall survival, and reduce surgical adverse effects. Adjuvant radiotherapy is the application of radiotherapy after surgery to reduce the recurrence risk. Finally, radiotherapy can be used for palliative and supportive care. Some cancer-related symptoms such as bleeding, obstruction, dyspnea, and dysphagia may worsen the quality of life of patients. The goal of palliative radiotherapy is to improve the quality of life. Do you know who is applying radiation therapy? A team of experienced medical professionals are taking care of the patient during radiotherapy. The team may include 1. Radiation oncologist, the doctor that's specially trained in cancer radiotherapy, who decides the application and planning of the radiotherapy, and supervises the treatment. 2. Radiation physicist, a healthcare professional who makes sure that the devices work as they should and that the exact dose decided by the radiation oncologist is given. Do you know who is applying radiation therapy? 3. Dosimetrist, the person who helps the radiation oncologist to plan treatment. 4. Radiation therapist or radiation therapy technician, someone who operates radiation equipment and helps position patients within the device during each treatment process. 5. Radiation therapy nurse, a nurse who has special training in cancer treatment and gives information to the patient about radiation therapy and the management of side effects. The side effects of radiotherapy. When it comes to radiation effects and side effects, remember that each person reacts differently to treatment. Any side effect you may experience depends on the type and location of the cancer, the dose of radiation given, and your overall health. Some patients have few or no side effects, while others may experience a lot of side effects. The side effects of radiotherapy. Keep in mind that the type of radiation side effect you may have depend on the dose and schedule prescribed. Most side effects go away within a few months after finishing treatment. Because it takes time for healthy cells to recover from radiation, some side effects may persist after treatment ends. The side effects of radiotherapy. Early side effects occur during or immediately after treatment. These side effects tend to be short-lived, mild, and treatable. They usually disappear within weeks after treatment. The most common early side effects are fatigue, feeling tired, and skin changes. The side effects of radiotherapy. Late side effects can take months or even years to appear. These side effects can occur in any normal tissue in the body that has received radiation. Fatigue, skin problems, hair loss, low blood count are common side effects of radiation therapy. In addition, radiation therapy has certain side effects that are specific to the treatment site. The side effects of radiotherapy. Fatigue is feeling physically, mentally, and emotionally tired. It is very common in people with cancer and often also happens with radiation therapy. Most people start to feel tired after a few weeks of radiation therapy. The side effects of radiotherapy. This is because radiation therapy destroys cancer cells and healthy cells. Fatigue usually gets worse as treatment continues. The stress caused by being sick and long journeys to reach the treatment center can increase fatigue even more. The fatigue felt during radiation therapy is different from the tiredness of daily life and may not improve with rest, may last for a long time and may interfere with your usual activities. However, it usually disappears over time after treatment ends. The side effects of radiotherapy. Your skin in the radiation therapy area may appear red, irritated, swollen, blistered, sunburned, or tanned. After a few weeks, your skin may become dry, flaky, itchy, or peeling. This is called radiation dermatitis. These problems usually go away gradually after treatment ends. But in some cases, the treated skin remains darker and may be more sensitive than before. The side effects of radiotherapy. Some recommendations can be applied to minimize the development of dermatitis during radiation therapy. These recommendations are: do not wear tight, rough textured or rough clothing over the treatment area. Do not rub, scrub, scratch or use adhesive tape on treated skin. Do not apply hot or cold heating pads, heat lamps, or ice packs to the treatment area. The side effects of radiotherapy. Protect the treated area from the sun. Use only warm water and mild soap. Shave the treated area with an electric shaver. Ask your cancer care team before using anything on the skin. Rarely, radiation therapy can cause changes in the level of blood cells. If your blood tests show a decrease in blood cells, your treatment may be stopped for a week or as long as necessary to allow your blood counts to return to normal. The chances of a decrease in blood cells are higher if you are also undergoing chemotherapy. The side effects of radiotherapy. Site-specific radiation side effects directly related to the radiation therapy field. If you are receiving radiation therapy to the brain, you may experience headaches, hair loss, nausea, vomiting, hearing loss, memory and speech difficulties, seizures. If you are receiving radiation therapy for head or neck pain, even open wounds, you may experience dry mouth, difficulty swallowing, changes in taste, nausea, earaches, tooth decay, swelling of the gums, throat or stiffness of the neck and jaw. What is radioactivity after radiotherapy? Another important issue related to radiation therapy is radioactivity. Patients often have concerns on this issue since they are worried about their relatives. External beam radiotherapy does not make patients radioactive, it does not emit radiation to their surroundings. Patients who receive internal beams receive radioactive implants, brachytherapy, or receive radionuclide therapy may be radioactive, emit radiation to their surroundings, for a few days to a month. But, they are discharged from the hospital or radiotherapy facility only when radiation safety is assured. Radiotherapy and pregnancy or fertility. Reproductive system. It is a hormonal system that includes the pituitary gland, adrenal glands, testes, and ovaries. Radiation has direct and indirect effects on the reproductive system. After the exposure of radiotherapy, reproductive cells may die and fertility may be troubled permanently. Another indirect effect of radiation may occur since the pituitary gland being affected by radiotherapy. Radiotherapy and pregnancy or fertility. Women. It is important not to get pregnant while receiving radiation as it can harm the growing baby. If you are or might be pregnant, tell your doctor immediately. Be sure to talk to your doctor about birth control options if you are likely to become pregnant. Radiotherapy and pregnancy or fertility. Women. If the area of your body that receives radiation includes the ovaries, it is possible that the radiation dose will cause the ovaries to no longer work, infertility, and you will not be able to have children. It is important to know the risk of this possibility before receiving radiation therapy. If you are considering having children, it is very important that you talk to your doctor about this. Radiotherapy and pregnancy or fertility. Men. If a male patient is receiving radiotherapy and his partner is pregnant, the effect of radiation on the fetus is not clear. It is not advised to have children during treatment and for several weeks after treatment to be safe. If the radiation field includes the testicles, the radiation may cause infertility. It is important to inform the patient on this matter before the initiation of the radiation therapy. Radiotherapy and pregnancy or fertility. Men. There is no clear research on how the fetus formed by the sperm exposed to radiation affects its life during pregnancy and postpartum. If you need to receive radiation therapy to affect the testicles, talk to your doctor about how this may affect having children in the future. Does radiation therapy cause cancer? While the increased risk of cancer as a result of radiotherapy in adults is generally small, it is greater in children. While the risk is low for most types of treatment, such as head and neck cancers, the risk is relatively higher for a few types of cancer, such as Hodgkin lymphoma. Radiation oncologists should discuss the risks with their patients and inform them on all possibilities. Is radiation therapy safe and effective? All this information indicates that radiation therapy is a safe and effective option to fight cancer. An effective communication between healthcare workers and patients are essential for better outcomes. Always keep in touch with your healthcare professionals and ask any questions you have.